Hello everyone, my name is Zaina and today I'm going to give you a demonstrative speech. The time right now is 11:40 and today I'm going to show you how to palpate for sinuses, superficial lymph nodes, and check for masstoid or tracheal tenderness. You ever had a headache and you wonder, you're like, could this be related to an ear infection or to a sinus issue? These simple palpation exams will help you detect conditions such as sinusitis or infections or lymphotypic issues. And these issues are really important to identify because if you could just do a simple regular self checkup, it could save you going to the doctor and also help you identify issues way faster and way earlier so you know what steps to take after. So today I'm going to show you how to palpate sinuses first, then superficial cervical lymph nodes, and then to check for tracheal and masstoid tenderness. Important techniques like this are very easy to master, so I'm super excited for this. So first now, what we're going to do is palpate for sinuses. These are air-filled spaces that can become tender when inflamed. It could also lead to sinusitis, which is inflammation. So first, to palpate for sinus, so what we do is take two fingers like this and just press on your frontal sinuses, which is right above your eyebrows. And then if you do have sinusitis or infection here, then you feel pain. Right now I don't feel pain because I don't have sinusitis or any infection related to it. So what I just did was basically take two of my fingers and apply gentle pressure here. If you don't feel anything, that means you're all set and you're all good and you don't have sinusitis or any infection in frontal sinuses. Then we're going to do maxillary sinuses, which is right next to your nose right here. Again, two fingers and gently tap. If you do have any a maxillary sinus problem or infection, tenderness can happen, and then also this is also related to a tooth infection. So if you do feel pain here, it often means that maybe you have a tooth infection. And I don't have it there, so I'm all good. I don't have any problems with my tooth or maxillary problems. Next, I'm going to show you how to check for cervical lymph nodes. Cervical lymph nodes is right below your jaw, on your neck, on this part. What you do, gently take two fingers again, gently tap. So this is if you to palpate, just gently use your fingers along the sides. Go one or twice. If you feel any enlargement or any masses or any edema or any inflammation, then you know there's something wrong with the cervical lymph nodes and it's time to get it checked out. But for me, you could visually see that there's nothing. But sometimes when you can't visually see, it's important to just check right like this so you could feel anything. And so if you don't have any masses or enlargement there, that means you're free from infection in cervical lymph node area. And it's important to just check for cervical lymph nodes because sometimes they may swell up and it could be a response to an infection or it could be infection itself in that area. Lastly, we're going to go check for tracheal and masstoid tenderness. So the tragus is a small fleshy part right in front of your ears. You see this area? Yeah, right there. And it could sometimes this area could be inflamed, and inflammation around this area usually indicates that there's something wrong with the ear canal. So what you can do, two fingers again, just press on it gently. Pain, if you feel pain in this area, usually means that you have an outer ear infection or any inflammation in the surrounding tissues. And then for masstoid, just move your hair back and then take two fingers again on the back of your ear. Just gently tap. Tenderness around masstoid is usually more severe and it could lead to mastoiditis, which is a very big infection that happens in your bones near your ear. So this actually could lead to hearing damage or hearing loss, and it's very important to just check for it regularly so you don't feel any pain or any masses or just any enlargement. Like if you feel a bump, it's probably time to get checked up by your doctor. So that's it. Those are very few steps you can do to ensure that you don't have any sinuses or any infection or nothing wrong with the cervical lymph nodes or any ear infection or any tooth infection. And these are just regular steps that you can do on a regular basis, maybe once a month, to see if everything is okay. So today we have covered how to palpate the sinuses, the superficial cervical lymph nodes, and to check for tragal and mastoid tenderness. Each of these techniques help us detect potential infections or other health-related problems. At the end, all I want to say is this is a very simple way, and mastering the simple techniques can go a long way because you can do it each month and make sure you're not suffering from any infection, and this you can perform it on other people. This is actually a very important thing for nurses. As you can see, I am a nursing student, so I am credible for delivering this information, and this is very important and a crucial part of patient care. So these skills make a big difference when affecting patients and providing an effective care to yourself and patients. Thank you so much for listening to my demonstrative speech, and the time right now is 11:47. Thank you so much.